Yes, so I think the main things that we can all do to protect ourselves is number one would be if you are in contact with someone who has SARS-CoV-2 or COVID-19 coronavirus, however you want to phrase it, then number one would be to self-quarantine for 14 days and reach out to your doctor. Your doctor can then help you decide whether you need to get tested or not. And then that 14-day period protects you from spreading the virus to others. If you do feel like you have symptoms, but do not feel that it is a medical emergency, then you can also call your primary care physician to help decide whether you need to come in, whether you need to go to the emergency room, because just having coronavirus does not necessitate you going to the emergency department. It's more so the severity of your symptoms. So that's if you come in contact with someone who has COVID, or if you yourself feel like you're having symptoms. On the daily, what we can all do is wear a mask if we are going out into public spaces, if we are in buildings, and that helps protect you from getting germs and virus particles from other people, and then also from giving things out to other people if you are asymptomatic and don't know that you have the virus. The third thing that we can do is frequent hand washing. That means washing with both soap and water for 20 seconds, and doing this frequently, meaning when you leave the house and come back, when you are going to the kitchen, going to the bathroom, in public spaces, bringing hand sanitizer with you if that is available to you, and just being very mindful of like touching your face and your eyes to try to decrease your risk of spreading the virus. Another thing we can do is socially distant. And so remaining 6 feet between people that you are interacting with on the street, or if you have to go to a store, remaining 6 feet away. Another thing that we can do is if you do have to do certain activities, say, you really need to go get your hair cut or go to get your hair done, and that's important for you, it's important for your mental health, then talking with your stylist or your barber about what processes have been put in place to make sure that you're staying safe when you're getting those services if they cannot be avoided. In addition, it is now fall, and fall means flu season. And so the flu is another virus that we know can make people really sick. And so we don't want two different pandemics going on at the same time. The flu, we do have a vaccine for. And so I would encourage you to get the flu vaccine. It's available at most doctor offices right now, as well as local CVSs that can be covered by most insurances. And so getting the flu vaccine can help protect you against the flu and protect us all from two pandemics happening at the same time. The reason the flu vaccine is so important is because it can decrease not only your risk of getting the flu, but if you so happen to still get a strain of the flu, it will decrease the severity of your symptoms. And vaccines are what we're hoping that we can get for COVID. So while we have vaccines for other viruses, it's important to get those and stay up to date. Lastly is stay home if you're feeling sick. Really check in with yourself and think like, am I feeling fatigued? Do I feel like I am having a little bit of a cough or a tickle in the back of my throat? And staying home, and if you do have things that you need to do or people that you're trying to meet up with because you have to, just being very forward with them and saying, I'm not feeling well, or I'm having these symptoms, and reaching out to your doctor to let them know that you're not feeling well, and they can help advise you on if you need to get tested or not. Yes, and I want to be very clear that the reason why there are these disparities in both number of cases as well as adverse outcomes such as death from COVID-19 for Black and Brown communities is because of systemic racism. Racism is ingrained into the fabric of America, And we need to uproot that systemic racism to really advance health equity. I can give a broad-based example of how this affects Black and Brown communities. So when we think about racism, that creates an environment of stress on the people who are receiving the racism, so much so that it can affect people before they're even born, depending on what stressors your parents and grandparents felt. Those all can get embedded into our genes and cause some adverse outcomes in things like infant mortality, low birth rates that affects particularly Black communities more than white communities. And because of that stress, it creates the environment in your body. So for people to get things like hypertension. And so when Black and Brown communities have higher rates of hypertension causing stress within blood vessels, that creates them having higher rates of things like stroke and heart disease. And what we know about COVID is that more adverse outcomes such as hospitalizations, intubations, and even death occur in those with comorbidities or additional diagnoses such as hypertension, heart disease, history of blood clots. And when people have those diseases, they're more likely to die. And who's more likely to have those diseases? Black and Brown communities. And why are they more likely to have those diseases? Because of systemic racism, because of the stress that America has put on their bodies. And that is done through policies such as redlining, that is done through environmental racism, such as where is the available and affordable water and electricity, where are factories built, economic injustice, who is able to accumulate wealth in families and who's able to then have upward mobility, who's working jobs in which they have to have more interaction with more people and therefore putting themselves at more risk for contracting the virus. So all these things work together and are embedded in why Black and Brown communities are more severely affected by COVID-19. And until we can have a society of anti-racism, we won't make change that I'll at least be happy with. And so as a physician, as a social justice advocate, I'm working with a number of people. There's a number of people who are activated about these issues in healthcare, as well as health systems that are really trying to create, a game plan for how we can be part of the solution instead of perpetuating the problem with health disparities. Health systems and health professionals exist to serve patients. That's our number one priority. That's our number one goal, is to help you feel better so you can go on and do the things that you love to do and live a long, joyful, and productive life. If when you go to the doctor or the hospital and you are experiencing things that make you feel like you are not getting quality and equitable care, that is a problem. And there's a number of different avenues that you can take. I think number one is having a primary care physician. This is a generalist doctor that specializes in you and specializes in making sure that they are in tune with what your needs are and when to refer you to a different specialist, and has many touch points with you throughout your care trajectory, and they're your go-to person. So finding a primary care doctor that you trust, that you feel listened to, that empowers you to make healthy decisions is one of the best things that you can do. Number two is, if you're not satisfied with the care that you're getting in that encounter, I encourage you to ask questions. If you're not understanding either medical language that a provider is using, ask, what do you mean by that? Or why are you suggesting this? And feel empowered to ask those questions, because they should be answering those willingly. and giving you the information that you need so you can make the appropriate decisions for your health. There's also a number of backup systems in place for when patients are experiencing these negative encounters. So most health systems have something called patient relations, and they serve as advocates for patients and to help improve communication between both the medical team and the patients. And these are experts in making sure that if the patient's over here and the medical team's over here and they're just not coming to a common mutual understanding, they can help facilitate those conversations. So reaching out to patient relations is another option that individuals have. Also, if you are experiencing something egregious, report it. There should be no place for racism within medicine. And the more that we report things, the more that we have that data, we can act on those situations. And so if you feel uncomfortable in that particular situation, you can always report things retroactively. And in addition, it doesn't just have to be you talking to the physician. You can tell the nurse of what so-and-so said to you that made you uncomfortable. I really want to empower patients to speak up and to speak out. I know there's a huge power differential when it comes to a patient and a physician relationship. The more that we can close that differential, the more that we can better serve our patients and understand where they're coming from, the more that we can facilitate quality care. Lastly, if there is a language barrier, you are entitled to an interpreter. The medical team should get an interpreter for both yourself and your loved one in whatever language is the primary or language that people are most comfortable with. And if everything cannot get done in one visit because of time constraints, request another visit. Social isolation in this pandemic is so real. We're seeing it in the hospital with the number of teens and kids that are coming in with depression, suicidality, in particular for our LGBTQ communities. And I would encourage people to, number one, talk to someone. If you're feeling down, you're feeling unsafe, talk to whoever your trusted loved one is in your circle and talk to your primary care physician. Because once again, it's really important that you have that person who's a medical professional who's always supposed to be in your corner to help facilitate you to care. And definitely call 911 if it is an emergency and you're thinking of hurting yourself or hurting someone else. In addition, thinking about those things that gave you joy pre-COVID, whether it's hanging out with friends or a certain sport that you like to play, if you're really into theater, and trying to get creative on how you can still have those moments of joy, even in the world of social distancing in COVID-19. So for example, if it's theater, that's hard to do when you're separated, but if you can do something over Zoom, if you have a sibling that would be willing to read plays with you, then that's an option. If sports are your thing and it's really hard to play that in a safe way with COVID-19, then is there another individual sport or a socially distanced sport that you'd be able to engage with, or watching it on TV? I know it's not the same, and hopefully with all of the measures that the state is putting in place to protect us, we can get out of this sooner rather than later so that everyone can get back to the activities that they enjoy. For those who are facing social isolation from not being able to hang out with your friends, still trying to make some type of time to still talk to them. I know it's not the same as being there in person and having school in person, but still talking with them on the phone, on FaceTime, finding activities that you all can do online, whether it's playing a game online or doing something engaging so that you're still getting that quality time with the people that you care about and the people that make you feel good and feel valued. In addition, there are ways to meet each other in person and stay safe. I think it really is about doing a risk benefit ratio for you and for what that looks like for your particular family and your family's situation. So, for example, if it is between worsening depression and seeing your best friend and going for a socially distanced walk with masks, with hand sanitizers, and being extremely transparent with those who live in your household who are also in your pod, and everyone is in agreement, everyone agrees that they will take the proper precautions to wear masks, to use hand sanitizer, to socially distance when possible, and that everyone's taking low risk behaviors, then that may be a situation that's appropriate for your family to really still do the activities that they enjoy. It's important that everyone is on the same page and that everyone is taking the same risk, because if one family is then going to a large social gathering without masks, then that puts that other family at risk. So having a very transparent conversation about that can facilitate that process.